Hi, my name is Caitlin Dale and this is video 31, setting up for anesthesia. So first I am going to turn on my oxygen and I'm going to make sure that it is full enough for the procedure today, which it is. Second, I am going to check that the vaporizer is full with isoflurane. So in my clinic that would mean up to this fill line here, which it is. Next, I do just need to make sure that the soda lime canister isn't exhausted. So in our clinic we use the chart from ACVN, which indicates when it needs to be changed. Soda lime has a useful life of 6 to 10 hours and the chart indicates to change it at every 8 hours. So whenever we are using a rebreathing circuit, we do just cross off for every 15 minutes and change at 8 hours. When we do change the soda lime canister, just make sure you are wearing PPE, so pop on your eyewear, your mask and your gloves, empty it and then refill back up. And in our clinic that means completely full with no gap. Mia is our patient today. So she is a canine and she weighs 7 kilos. So I have checked her patient file and her chart for her weight today so that I can work out her circuit and her rebreathing bag size, as well as just check that there's no special requirements or allergies. So I have got here a AIRS T-piece. So this is a non-rebreathing circuit, which Mia does need because she is under 7.5 kilos today. And I do have a 500 milliliter rebreathing bag. So this is suitable for Mia because I have done my calculation. So 10 milliliters times by her body weight of 7 kilos and then times by 6 divided by 1,000. So that does equal 0.42 litres, so 420 millilitres, and I have rounded up to 500 millilitres. To connect this today, I am going to connect the inspiration limb, so the blue limb here, to the fresh gas outlet, and I am going to connect the white tubing here, which is the expiration limb, and that is going to connect to my scavenger, which is the charcoal canister down at the bottom here to collect the waste gases. So that will connect onto the end here, and then my rebreathing bag will connect onto the end of the expiration limb as well. And then this end is the patient end, so this is the Y piece, so that's what does connect to our patient's ET tube. So I am going to test this just to make sure that there are no leaks in the circuit. So I am going to occlude the patient end here with my palm. I am going to close off the pop-off valve here, and then because our oxygen, our anaesthetic circuit, doesn't have a manometer, I am just going to fill my my rebreathing bag manually with the flush button of the O2. I do now need to listen for any leaks for 20 seconds. My bag should not deflate or lose pressure during that 20 seconds. If it does mean that I do have a leak somewhere in my circuit, so I would need to check all of my connections, all of my seals, the circuit itself and the bag. Soapy water can help here, and then I would have to retest. If after 20 seconds your pressure in your bag stays the same, perfect, no leaks. Still keeping your palm over the Y piece here, you will release your pop-off valve here and your bag will deflate. And then you're all ready to go. Ensure that pop-off valve does stay open here. Before anaesthetising any animals, you should make sure that that's all fully functional and that you do have everything you need to anaesthetise them for surgery. So I have got here my 3 ET tubes, so a selection of sizes, one that you think will fit, one smaller and one larger. You do need to test their cuffs, so fill up the cuffs with air and obviously make sure that there's no leaks in your ET tube as well. Check all of your ET tubes for cleanliness and obviously functionality, and then deflate those ET tubes, so then you are all ready to tube your patient. I have got a few other things all here ready to go as well. So I've got my clippers, for obviously catheter in the patient, so clippers, Emla, I've got my 22 gauge catheter and a spare. I do have some tape, I have my cotton wool and my Chlorhex Metho, I have my catheter cushion, my soft band, my vet wrap, I have my teapot which has already been primed, and I have my flush here. I have also got some lubricating jelly, some sterile lubricating jelly to help tube the patient. I have got Visco tears, so iLube, and then I do also have my laryngoscope handy. I am now going to, as per vet's instructions, get ready Mia's pre-medication. So she is having acepromazine and methadone today. So I am going to do 0.02 mg per kg of the ACE times her body weight of 7 kilos, and then divide by the concentration, which is 2 mg per mil. That does work out as 0.07 mils of ACE, and then my meth is 0.4 mg per kg times by body weight divided by concentration of 10 mg per mil, which does equal 0.28 mils today, so that is 0.35 mils. She is going to be induced with alfaxolone, so that is 2 mg per mil times by 7 kilos, and then divided by 10 mg per mil concentration, so that will equal 1.4 mils of alfaxolone today. So I am going to draw this up and just simulate with water for injection. So I have got 0.07 of ACE, and then I have got 0.28 of meth in the same syringe, and draw that up to 0.28. I am going to label that today with ACE meth sticker and pop that in the basket with Mia's full name and her patient number. And I am going to draw up my alfaxolone to 1.4 mils, and label with my alfaxan, so 1.4 mils, and again pop that in the basket. Thank you.